Coming up today, it's the season for celebrating and overindulging. Did you know there is a real medical condition called holiday heart, and it can be triggered even by one extra cocktail? This morning, we'll show you how to recognize the signs and also the simple test you can get to assess your heart health. Good morning, I'm Alexis Del Cid. Welcome to the Morning Medical Update. We are smack in the middle of December, and those holiday gatherings are ramping up. Maybe you have one tonight. Today, we're exploring a condition called holiday heart. For some people, holiday heart can be triggered even after a single drink. And there is also a simple scan that you could schedule today to get a snapshot of your personal heart health. That is called a cardio score. We'll get to that in a minute, but first, morning rounds. This week, the FDA launched a safety review of 2 approved RSV drugs for infants. There have been no safety issues reported, but there is a review issued. Joining us this morning is critical care pediatrician Dr. Sean Sood. Dr. Sood, you're here to help us understand current advice for parents. But first off, for non-medical people, how do you explain RSV and what are the signs and symptoms?
Thank you for having me. RSV, or respiratory syncytial virus, it's a highly contagious virus that causes respiratory infections in babies. For most older children and healthy adults, it's a mild illness, what you would call a common cold, a runny nose, cough, sneezing, and maybe a low-grade fever. However, for our most vulnerable patients, infants under 6 months and adults over 65 years of age, RSV can be dangerous. It is the leading cause of hospitalizations for babies in the United States when it moves into the lower airways, causes conditions like bronchiolitis and pneumonia. Parents should be less focused on the runny nose and more focused on the breathing effort and behavior. Breathing difficulty, regarding that, you should look closely at your child's chest. Are they breathing very fast, shallowly? Are they working harder than normal? Watch for a term that we call retractions, where the skin sinks in between their ribs or under their neck with every breath. That is a clear sign of respiratory distress. And then also watch for lethargy. If your baby is unusually tired, sluggish, hard to wake up, or too exhausted to eat because they're struggling to breathe, that is a medical emergency.
So what are you recommending, as far as the review goes, what are you recommending now to parents when it comes to the medications?
Sure. First, regarding that FDA review you mentioned, it is important for parents to know that the FDA routinely reviews data. The safety and effectiveness of the RSV vaccines were demonstrated in over 50 clinical studies involving more than 400,000 infants. Additionally, there have been no new safety issues reported with more than 6 million babies immunized worldwide. So the tools we have are effective. So my recommendation to parents watching remain prevent, protect, and act. Number 1 is to prevent. Hygiene is your first line of defense. So wash your hands and disinfect toys. Never kiss a baby if you have any cold symptoms either. Number 2 would be protect. Now, we have 2 options now in our back pocket to protect babies: a vaccine for moms while they're pregnant, or a long-acting antibody shot for a baby after birth. My strongest advice is to speak with your child's pediatrician about which preventive measure is right for your family and your baby's specific risk factors. And then number 3 is act. If you see those red flags, those symptoms we talked about, the retractions or lethargy, trust your instincts and seek medical care.
Dr. Sean Sood, thank you so much for being here. We really appreciate your expertise in joining us.
Thanks.
Have a great weekend. And now to our main topic of heart health. Joining us are 2 of our cardiologists here at the health system. On the set with me, I have cardiologist Dr. Mazer Afek here in the studio. Thank you for being here.
Thanks for having me.
And joining us virtually from the health system's Olathe campus is Dr. Shannon Hughes-Thompson, also a cardiologist. Thanks you for joining us, Dr. Shannon Hughes-Thompson. And we also have live registered nurse Kay Ness. Kay is a cardio score educator. We're talking about the cardio score today, and with her is patient Kathy Allen. Kathy is going to let us follow her along this morning as she gets a cardio score. Man, talk about invasive. Thank you for letting us come with you on a scan and your doctor's appointment this morning. And she's going to learn her results live on the program. This is why we love our doctors and nurses and participants. They let us join on their journey. So we'll get to the topic of holiday heart in just a moment, but let's continue with the holiday score, the cardiac score. Kay, can you explain to our guests, what is a cardio score and what are you scanning for?
So this is a very quick, easy, painless look at the coronary arteries, and we are specifically looking for any hard calcified plaque.
And so what does patients like Kathy need to do to prepare for this?
She doesn't have to do anything to prepare for this. You don't have to hold medications, you can wear metal, so you can take your medications. So this is a very easy test. I always say it's the easiest test you'll ever do.
It actually is, because Kay, you gave me a cardio score about 1.5 years ago, and it was so fast and so easy. It was unexpectedly easy. How long do you expect Kathy's test to take?
This will take less than 5 minutes, and then the CT techs will actually process the images and get us the results right away, and then we'll go over the results.
We're going to let you and Kathy get started, and then when Kathy's done, we're going to put a mic on her so we can ask her some questions. Kathy, good luck. We'll see you in a little bit.
Thank you.
Thanks.
And Dr. Affek, at what age do you recommend patients get a cardio score?
Usually somewhere between age 40 and 75. Those are the age ranges.
40 and 75. Why not younger than 40?
Typically because the calcium score is looking at hardened plaque. Usually before the age of 40, the plaque hasn't had time to actually harden.
So is plaque a synonym for calcium? Is that what we call it, a calcium score?
Mm-hmm.
Okay, so we're scoring how much of that is in the arteries.
Yes.
Dr. Hughes-Thompson, is this a test that has to be requested by the patient, or is this something that you as a cardiologist would recommend? And also, as you answer that, we're going to show some video of the live cardio score in progress with Kathy.
Yeah, so actually it can be both. Obviously your doctor can recommend it and order it, but there's a lot of programs and systems for people to actually request it or have it performed outside of their medical provider's order. I think it's really important people understand that it's meant for a very specific population. Not everybody should undergo a cardio score. It is for people who have a difficult to assess risk, who aren't truly low risk, who aren't truly intermediate or high risk. So it's meant for people who have a hard time determining just what their risk for cardiovascular events is. And it's just that. It's about the risk. It's not about unstable disease.
Which leads me to my next question. Is this something that ideally a cardiologist would recommend, or is this something you would prefer another doctor, like a primary care physician, recommends before they need you?
So it's something general doctors have performed all the time, and then sometimes that'll lead to a cardiologist and seeing the patient. But again, it's similar to managing somebody's blood pressure, diabetes, talking to them about not smoking. It's another way to help them understand what their risk for cardiovascular events is. And I would say most family physicians, internal medicine doctors are very capable of helping make those decisions and decide which patients are best suited for this test.
So there we saw, she went in the room. They closed the door. I was looking at you while you were talking, but I think what they have is Kathy getting ready and going into that. She'll sit and kind of go through this tube. And as she does that, it was so fast. I thought, I think Dr. Affek, I said, so what else? And they said, it's done. It was that fast. I thought we were just kind of getting started. How could the results of whatever Kathy's score is, so she's in it right now, just getting, that's what it looks like.
Correct.
So how could these results affect the care plan put in place by her doctors?
Well, it's about getting information, and as Shannon was saying, is that it gives us an additional look in helping to risk stratify, meaning how much cardiac risk does somebody have. So the awareness component is super important, because it might be the trigger that allows them to say, look, I'm going to be more focused on my heart health. So that's why it is very accessible, it is very affordable. And the change in management, I think, really comes along with what are the other risk factors that this person has. You know, are they diabetic? Do they have high cholesterol? Are they overweight? Are they smoking? You know, family history we can't change, but again, it sometimes provides that that trigger to say, okay, I'm really going to focus and do some different things. The biggest thing I think we do is certainly in our practice in prevention is focus on the modifiable risk factors that we can do. Cholesterol being a big factor in one of them.
I'm so surprised because once I started working here 5 years ago, I learned about a cardio score. I never knew these existed from my doctors at other places. Is this something specific to the health system? Is this something that we have more awareness of because we're within the health system? Why didn't I know about this until 5 years ago?
It's been around, actually. It's been around for longer than that, a lot longer than that. It's become more accessible. Actually, in our health system, we've been fortunate that our Kansas City's women's soccer team, KC Current, had provided us a grant and covering. So that helps our patients, our female patients, come in for access to this. So there is a lot more awareness like that, and patients are becoming more aware through programs like this as well.
As we talked about, it's so fast, she's done. So Kathy's out of her test. We're going to check back in with her in a little bit and learn her score, which hopefully she scored low. This is the only test you want to score very low on, as low as possible. While we wait to talk to Kathy, let's get to holiday heart. Holiday heart is a specific medical condition that can be triggered by something as simple as a cocktail. They call it holiday heart because doctors will tell you they see more cases of this around the big holidays. Take a look. Have you heard of holiday heart?
No, I have not. No, I haven't. No.
While holiday heart may not be a familiar term, a basic hangover has happened to the best of us. Have you ever had too much to drink?
Yes.
Whether it's that one time in college or your best friend's wedding last month, most of us have overindulged at least once in our adult lives. And for many, once was enough.
Loss of equilibrium, inability to think straight, and inability to reason, loss of inhibition.
With drinking, it kind of slows down motivation a little bit. You know, it makes you tired, makes you not want to be as active and stuff.
But avoiding alcohol altogether can be incredibly difficult.
I drank more during the pandemic because there was nothing to do. And I didn't have to anywhere to get up to go.
Not to mention, references to drinking seem to be everywhere you look or click these days.
Oh, how it's wine o'clock somewhere, or you just, everywhere I go there's a t-shirt or a towel or a magnet or something with it on it.
About drinking.
About drinking.
I definitely think it's become so normalized drinking. There's everything you do is drinking, the paint and sip, you know what I'm talking about? I don't know, I think it's become so normalized now, and social media probably plays a part into that for sure.
It's definitely a huge influence of, drinking and stuff.
But can 1 week or even one night of drinking more than usual really have an effect on your heart? Cardiologists say absolutely. Holiday heart, also known as alcohol-induced atrial arrhythmias, is very real. It manifests with heart palpitations, a racing heart, or shortness of breath. In fact, a recent study funded by the National Institute on Alcohol Abuse and Alcoholism shows just one beer, wine, or cocktail can have an immediate effect on your heart rhythm, significantly increasing your chances of atrial fibrillation within just a couple of hours, even if you have no underlying history of heart disease. And that's not the way you want to end any good time, right? With holiday heart. We love our questions and our comments from our viewers, so if you have something you'd like us to read aloud or share during the program, you can send it to us right now throughout the program on email, the Medical News Network, or YouTube or Facebook. Dr. Hughes Thompson, I want to start with you because there's a recent study by the American College of Cardiology that says even just one glass of wine, beer, or other cocktail can double your chance of an AFib event within 4 hours. Is that for everyone?
No, it really isn't. The thing about holiday heart is it's usually just an overindulgence, and alcohol is usually at the core of it. But usually people become significantly dehydrated, have been exposed to less sleep. I mean, usually it's a combination of things that really set it off. You may have some subtle symptoms or very transient symptoms. True holiday heart is somebody who usually goes into a sustained rhythm and actually show up in a care facility, an urgent care, an ER, or a doctor's office because it's lasted more than, say, a hangover or something is where a couple Tylenol, ibuprofen take care of it. I have to admit it's one of my favorite conditions because it is very reversible and has a lot to do with behavior and recognition of situations that put you at risk, and there's usually a pretty interesting story to go with it.
I've never heard a doctor call one of their favorite conditions their favorite, but it makes total sense. It's treatable, probably does have a good story. For viewers without medical backgrounds, how do you explain AFib and what would that feel like? What would holiday heart feel like to someone getting it?
So they do. A lot of times they'll feel kind of weak or just don't have very good energy. Some people more than others will actually tell that their heart's racing, skipping, going irregular. They can just tell they're not right, and they just aren't recovering in the time that they typically would. But again, it's usually associated with a big weekend that's got you completely out of your normal routine as far as what you're eating, what you're drinking, and how you're sleeping. And that's usually what sets it off. And some people have a very mild form and we never actually see them, but the more prolonged episodes or pronounced episodes show up in front. And sometimes we have to intervene, but a lot of times it's just kind of getting them through the immediate effect and getting them back on track.
The American Medical Association has recommended cutoff limits on drinking. This is kind of tricky though, because what's considered a standard size drink in the medical community is not what they give us in the bar. The one drink can look very different from the pour they give you at the bar. How do you explain the cutoff limits and what a standard drink is related to that?
I don't know, maybe Dr. Offik might have something more to offer there, but I would say not all people are created equal. When you talk about the guidelines, we know that certain alcohols, maybe in certain people, have more of a propensity to provoke this, but I would say it's not one size fits all. But you have to be aware of your limits and recognize if you're not feeling right or when you need to make that decision to stop or get hydrated or get some rest and not go to that next level.
Dr. Offik, what do you recommend if someone comes home after a night of drinking and they've got that racing heart, or they wake up in the morning and their heart is racing? Mm-hmm. What do you recommend? They wait it out or they go to the ER?
You know, with so many people have wearable technologies now. You know, some people have smartwatches, and that can sometimes help, but it's not necessarily diagnostic. I think if you're not feeling well, then always seek medical advice. And I think that's not, that will never be the wrong answer. Okay, if you feel that your heart's racing, you might get additional information from your smart appliance. That could be wrong though, right? But if you do get additional information, it confirms it, then that's one way of saying, okay. But bottom line is seek medical advice if you don't feel right, and this could be a factor.
At least make a call.
Yes,
because oftentimes the person answering the phone will say, what are your symptoms? And then they tell you if you should come in.
Yeah.
How often would something like this go away on its own? How often would holiday heart go away on its own?
So it can be self-limiting if somebody is well, meaning they don't have underlying heart conditions. So it can, in 24 to 72 hours, resolve.
In your experience with your patients who've had holiday heart, first of all, how much busier do you get this time of year from holiday heart?
You know, I think the busyness actually comes to the emergency room, because that's usually where they present. Coming into the office, for example, you know, it may have resolved by then, but usually people who are presenting are coming to the emergency room because they're feeling the palpitations, they're feeling, you know, shortness of breath, something's not right.
How do you know the difference between it being triggered by a drink and it being triggered by an underlying condition they already had?
So you don't know, and unless somebody has a history of atrial fibrillation, if they already have that, then they can be that can be exacerbated. It could be made worse.
Okay.
But if this is a new diagnosis and somebody feels out of sorts, that's when they're going to present to the ER and say, hey, I don't feel right. An ECG will be done. and then we can diagnose it from the tracing of the heart.
Is there a typical age range that's more vulnerable to holiday heart? I'm picturing, look, I have a son in college, and every parent who has a kid in college worries about the drinking that happens in college, or is this more of a 40-plus thing?
Anybody who can, binge drinkers get this more. So anybody who would potentially binge drink, have acute alcohol toxicity, can be at risk.
The wild thing about the definition of binge drinking is it's not what you think in the movies. When I hear binge drinking, I picture someone doing a keg stand and chugging beer after beer. This could be, I think the number I heard was like 4 drinks in one night is considered a binge drink. Which would cover a lot of people in America.
Right, and actually drinking quickly as well. So it's, you know, if you have drinks which are spaced out, that has a different biological effect for somebody who's actually drinking a lot quickly.
Oh, so it's the speed as well.
Yeah.
If you're just joining us live, we're talking about 2 topics, both heart related today. We're talking about holiday heart, and we also have our patient Kathy, who let us go along live while she got a cardio score. So we're going to check in with Kathy in a little bit. You can see her in the office. This is where, I know this office because this is where I sat when I got my cardio score. You go into Kay's office, you sit there, and it's like you're at the teacher's office and she's going to read you your grades, your report card. So we're going to talk to Kathy in a little bit once she gets her score. Dr. Affeck, about the the cardio score, if someone gets it and they don't love their results, can they redo it a few months later? What would be the next thing you recommend for them?
So if the calcium score is positive, meaning it's more than 0, that means that there's the presence of hard plaque. Okay, so and we don't recommend repeating a calcium score once it's positive, because that's already shown us that there is hard plaque. So repeating it won't be necessary. If they don't love their score because it's positive, I think what the opportunity comes about now is to say that, well, what can we do with this information? How can we manage and change lifestyle and medications and be proactive about the result?
So anything over a 0 means there's calcium.
Correct.
In your arteries.
Correct. And one important nuance I have to say is that even if there is a calcium score, hard plaque, it doesn't actually tell us if there's soft plaque. So this is the important nuance of, so we can be falsely reassured with a 0 calcium score.
Oh, so you could have 0 hard plaque?
You could have 0 hard plaque, but you can still have soft plaque. So that's something that we're educating our patients about too.
How do you scan for soft plaque?
So soft plaque is more invasive, meaning it's a different type of CT scan. It's a similar CT scanner, but with a different type of software requiring more radiation and requiring dye. Yeah, requiring contrast.
We have Kathy's scores in, and Dr. Thompson, I'm going to get to my questions for you as well. I'm waiting to look at this video monitor I have in the studio to see if we're ready to talk to Kay and Kathy about the results. Kay, can you talk about the results with us?
We sure will. Okay.
And Kathy, are you ready? Are you ready to do this live?
Yeah, I sure am.
Okay.
All right, so we evaluated your coronary arteries, your heart arteries, looking for those deposits of calcified plaque, and those deposits are markers for heart disease. So when we look at these numbers, this is based on the volume and density of the area detected, not checking for blockages. Okay. Now, you do have a test after this that is specifically looking for blockages.
Right.
So let's get into the numbers here. So again, these numbers are based on the volume and density of the area detected. So in your left anterior descending, which is this coronary right here off of that left main coronary artery, you have a score of 181. And in the right coronary artery, we have a score of 44. So those were the 2 coronaries that we did detect those deposits of calcified plaque. We total those up, and then that becomes your calcium score. So 225 is your calcium score. This is how we classify your score.
Okay.
Falling in that range, that mid-moderate range.
Okay.
Even though we're not checking for blockages, we do know the higher the score, the higher the risk. And we'll talk more about how to lower that risk. but at this point, again, this is a moderate amount. Now, the probability of having some detectable plaque does increase as we age.
Sure.
This is still more than we'd want to see for a female your age. So when I take your score and compare it to other females your age, we use 2 different calculators to compare your score. And both of them are putting you, again, above, not that we want to be average for heart disease, but above average. So in the 80th percentile, meaning 20% have a higher score than you.
Okay.
The other said you're in the 85th percentile. That means 15% have a higher score than you.
Of women my age?
Correct.
Okay.
And that is attached here. So this is that data. This is the probability of having a score at your age. So it is common to have a score at your age, but the average score for a female your age is a 9. So your score of 225 is putting you in that top 15% of scores.
Kay, can I jump in here and ask Kathy a question?
Yes.
Because I know it. Go on. Kathy, what was the question you were going to ask Kay?
Oh, I wasn't.
Oh,
Oh,
I thought she was going to ask me a question.
I do have a question for Kathy. Sorry, we have a bit of a delay, and I know this is a weird situation because we have a camera in your doctor's appointment. So, Kathy, thank you again. Kathy, I want to know, so I heard Kay say you're in the 85th percentile on one side, 80th on another. What's your reaction to hearing those results?
That's actually a really good question. I'm kind of in a little bit of a stunned state right now.
Sure.
I think mostly because I'm relatively, in fact, probably really healthy as a general rule, and so I'm just, truthfully, I'm kind of surprised, but you know, I'm willing to do the work to see if we can't get that thing lowered.
Boy, you are such a good example of how you can do everything right, and yet some things you can't control about your health. Thank God you're in the right place. You're with Kay, and she's going to get you set up and take you through those next steps. I do want to give you a little privacy as you go over the next steps you're going to take. But Kathy, can you just share with us a little bit more about how healthy you are? Because I think this is going to resonate for a lot of people watching, thinking that a cardio score might not be something they need. What are some of the things you do in your life that make this so unexpected?
Well, just as a general rule, my overall health has been excellent since, especially since I retired. I do yoga 5 times a week, and I probably fit very well into the 80-20 category of eating. I actually taught nutrition for 40 years, and so I understand the impact of food and what it does to your body. And so I do take pretty good care of myself. I do drink moderately, but I have not since this all has been happening. But my alcohol use has pretty much been, in the past 10 years, just red wine, and pretty much not that often. I guess trying to fool myself that, you know, it was healthy.
Well, that's what we've been told for years, Kathy, is that a glass of red wine is fine. And then now we're starting to hear that's changing. But it sounds to me like you're doing everything that a healthy person would do.
I honestly and truly pay attention. That health, you know, health and how I feel each day is paramount to my well-being.
I'm going to let you have more of a private conversation with Kay so you can figure out your next steps. Kay, for viewers who are seeing this and thinking, wow, I'm just like Kathy, I guess I should get one, what do they do next?
What do they do next to get the calcium score?
Yes, how do they schedule a calcium score?
So the easiest is to talk to your provider, your primary care provider, and see if you need and if it's appropriate for you, and then they can enter that order in, and then you can get it scheduled. You can also do what we call a self-referral process. If you are over 40 with at least one cardiovascular risk factor, then you can actually get this scheduled yourself and do it that way. So there are different options.
Kay, thank you so much. And Kathy, thank you for letting us come along for this journey. I know that you're still processing and you're understandably surprised, but by you doing this, whoops, excuse me, that was an alarm for myself to check something. By you doing this, you're going to help so many people watching who are thinking they're doing everything right, and they are, yet something could be lurking. So thank you, Kathy, for letting us go along for this, and hopefully we can continue checking in with you throughout your journey. I do want to go to some of the questions from our viewers because we are getting some great community questions. I actually have one for Dr. Hoos Thompson. Dr. Hoos Thompson, how surprising is it to you as a cardiologist to see a patient who has lived such a healthy life, is continuing, she does yoga all the time, she only drinks red wine, she eats healthy. How surprising is it to you as a cardiologist to see her not get the ideal cardio score?
So the first thing that jumps in my mind is I'd want more details. I need to know her age. I need to know whether or not she's had high blood pressure, ever smoked, family history, and her blood pressure, cholesterol. So I need to be able to do a preliminary set of what her risk would be before she had the test. Is the first thing that jumps. So am I surprised? No, but again, I think the story, the information to get a full assessment of her risk is important. And I, honestly, sitting here, I didn't have all that information before you did the score.
Sure.
So the score alone, it does not tell the whole story or set you up to make good decisions. It's just part of the picture.
I have a comment from Ruth Allen. Ruth Allen wants to share, I will be listening to the experts from the health system for the next few years to come. Thank you so much. Jeremy has a question. He wants to know, is it possible to have a bunch of plaque in your arteries and it just hasn't hardened yet? And can you reduce that plaque over time, or is it baked in there and now you're trying to get it just to slow down from building up more? That's a great question. Is it just baked in there now?
That is a great question, and hard plaque would tend to not regress. Soft plaque can regress. Okay, so we can have some effect on the soft plaque, and that's why being proactive is great. And I have to really thank Kathy for being so. Her being on the show has been so, I'm sure, instrumental for a lot of people.
Absolutely.
To say that, look, we do the right things, we look after ourselves, but there's some things which are just familial or genetic or those kind of things. And again, just to speak about Kathy for a moment, is that she's going to go for a stress test. We're going to see if any of that plaque, any of those blockages are actually causing any trouble.
Sure.
So, and if the stress test comes back as good, then that's also reassuring. So now, again, we have her, she has now the ability to just be a little bit more focused on what are some of the small changes that she can do. So, yes, it's a shock whenever somebody gets a score that they're not expecting, but I think it's important that we are walking hand in hand with her, and we'll see that, okay, what are the next steps, and take things from there.
She's in the right place, like
Absolutely.
we said. She has all these eyes on her.
Yeah.
She's got the whole team. Jean has a question. I'll take this one to Dr. Hoos Thompson. Jean wants to know, why would one drink, just one drink, have a negative effect that could trigger holiday heart?
You know, I would be careful. I think that's one component of it. What you drink and the situations leading up to that drink can impact you. You know, some people are more sensitive to wine. Some people are more sensitive to whiskey. Beer, unless you're putting several down, usually doesn't trigger it. Drinking one drink alone. And again, it's usually not alone. And you talk about the time of year. I see a lot more people in the summertime with dehydration, kind of a heat effect as well. So there's usually more than one factor. So can one beer be the tipping scale, or one drink be the tipping scale? You bet. But usually it's not the lone thing that we're really dealing with.
Dr. Afek, I have a question about red wine, because Kathy talked about how she only has red wine. I do remember about 15 years ago, there was a time when I was told, not by doctors here, but by a doctor, yeah, a glass of red wine a night's great for your heart. And it was kind of like, woohoo, here's my pour a goblet of red wine. Now it does feel like we're hearing the reverse of that. What's your take on even drinking a glass of red wine a night? Is there any benefit to the heart?
You know, the that information came largely from observational studies. So the impact was actually confounded by socioeconomic status, lifestyle, different things as well. So it wasn't just that the red wine was beneficial to your heart health. And now the American Heart Association has come out and said that, look, it's not actually accurate, and there's the benefit from red wine is actually countered by potentially the negative of the alcohol. And there are other drinks, some certain berry juices, pomegranate juice, for example, that also have antioxidant effects, so that you will get the benefit of heart health without the negative of the alcohol.
So a glass of pomegranate juice a night might be better than a glass of red wine?
Potentially.
It doesn't sound as fun, but I understand completely medically what you're saying. We do have one more question. This is from Judy. Judy wants to know, and Dr. Hughes Thompson, I'll direct this to you. If you don't want to avoid alcohol altogether, is any drink less toxic than the others? For example, would a beer be better than hard liquor, or wine be better than something?
The quantity matters. So as far as 8 ounces of beer is like 2 ounces of wine or something like that. There's kind of some conversion ratios we've come up with, but I would say typically I wouldn't pick one over the other. I would say it's when you start to stack it up or drink aggressively is when somebody gets in trouble. So I wouldn't necessarily pick on one type of alcohol more than the other. They can all lead to the same issue. But just common sense, and sometimes during the holidays we kind of lose that.
Thank you so much for today's takeaways. Dr. Hughes Thompson, I'll stay with you and start with you. What do you most want our viewers to know about Holiday Heart and about getting a cardio score?
Just know that Holiday Heart is just that. You have to make good decisions, and sometimes the situation you get carried away. So just listen to friends, listen to your body, and just you can enjoy the holidays and relax. And if that includes alcohol, great. But just make sure that that doesn't take over the situation and what's going on. Regarding coronary artery calcium scores, I think it's really important to know that hard plaque is there for a reason. Our body put us there because it recognizes the disease process. And calcium, in many ways, is kind of the stabilizer. So by itself, it's not the unstable thing. I use an analogy when I talk to patients, kind of like the blood vessels or the roadways of our body. And when you have a disruption or irregularity, you don't want a car accident or a major event to take place. And so our body naturally puts that calcium there for a reason. It puts that plaque there and hardens it to help stabilize that disease. And so that calcium isn't the issue itself, but the disease process that led to that calcification and that response is what we're trying to get to. And so the calcium's not the unstable problem. The issue is we want to stabilize so unstable plaque in conditions in those blood vessels doesn't erupt. And that's where not smoking, not being diabetic, watching how much you drink, staying away from cigarettes, controlling blood pressure, being aggressive with cholesterol, that's where that is the impact. So it's about managing the risk and changing the way you live, or making sure we're doing a great job of managing things that put you at risk. But it usually isn't more testing unless you're having symptoms. It really is about identifying your risk and making sure we're going after that as best we can.
Dr. Afek, what would be your message to Kathy, our patient? She's still processing, as she said she was stunned. So I'm guessing she's going to go home tonight and maybe watch this show back, right, on YouTube or Facebook. What would you want to say to her when she watches this evening, processing her results from this morning?
Well, I'd want to say to her, just as I'd said, I think it's having information is really excellent for her to know that this is what her plaque score is, and now we start the process of adjusting her risk, and make an appointment. Let's get in to see her in a formal setting, and let's walk this journey with her. We'll get an advanced lipid panel looking at her cholesterol to see if that's something that has made this more likely for her, because she said that she taught nutrition, so she's done, and she's active, and if she's doing all of the things that she can do. But part of this could be, again, genetic, familial. There's a blood cholesterol test that we look for a lot in these type of patients, looking at your lipoprotein A. So that's
We've done stories on
yeah,
that.
so the
with
lipid
Dr.
profile.
Moriarty.
Yeah, so that's going to be important to see if that's been a factor in her plaque progression. And again, we'll have the results of her stress test, and then let's make a game plan and say that, okay, what do we do next? And it isn't, yes, it can be daunting to get this, but I do want to say is that if you're otherwise healthy and you're not having symptoms, that's usually a good sign that any plaque is not to the point that we need to do any invasive procedure about, like a cardiac catheterization or stenting or something.
This isn't that conversation.
This isn't that conversation yet, because certainly with somebody who's not having any chest pain, shortness of breath, anything like that, it would be premature for us to say, oh, well, now let's take you to the cath lab. You know, that's not where this should be evolving to. This should be talking about purely about prevention and how we reduce her risk.
That's very reassuring. Very reassuring. Thank you, Dr. Afak, and thank you so much, Dr. Hughes-Thompson, for joining the conversation. And huge thank you to Kathy for letting us go along on your journey, and for Kay, our RN who did this. Kathy, you're going to help so many people by going through this publicly, and I bet you're motivating a lot of women to get this test. Thank you to our viewers as well. Coming up on Monday morning, learn how living liver transplants work. We'll speak with Marina and Brandon, the first living donor and recipient in the whole state of Kansas. It's been 1 year. We'll show you how both of their lives have changed since the transplant surgery. That's Monday morning.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.